Most of the time I also had cases where people are visiting hospitals and they are reaching out to me and saying that गौतम हम तो वहाँ जब भी जाते हैं, मुझे देखो 5 साल हो गए हैं, 3 साल हो गए हैं, मैं आज भी अगर जाता हूँ दवाई लेने तो ये लोग मेरे से ऐसे बात करते हैं जैसे मैंने कोई क्राइम किया है. When I was in 8th standard, और तब एक दिन ऐसा हुआ कि स्कूल बस से जब मैं घर वापस जा रहा था, then few of my friends, classmates, they called me हिजड़ा in front of everyone in the bus, and that was the last day कि मैं स्कूल से वापस आया, क्योंकि उसके बाद मुझे लगा कि अब मैं उन बच्चों को दोबारा फेस नहीं कर सकता. I was very scared that most of the time I only did unprotected sex, because during that time my partners also never told me that we should use condom or why it is important. So I took some time to go for the HIV testing, but the day I went for HIV testing in September 2009, that was my first and last HIV testing, as I came to know that I'm HIV positive. जब डायग्नोसिस हुआ था उस टाइम तक मेरे माइंड में ये नहीं था कि मैं एक्टिविस्ट बनूंगा. बट द मोमेंट आई गॉट HIV, आई रियलाइज्ड दैट आई एम 18-year-old and there are many Gautams out there who are not aware about HIV or who are struggling about their sexuality. So there should be somebody who is working for them. And that was the inspiration from within to start working for the people who are from this community and living with HIV. HIV के treatment के लिए जो लोग भी जाते हैं दवाइयाँ लेने के लिए, some or the other kind of stigma is always there. Like for example, I'm gay and if I'm going like this, behaving manly, then I might not face much discrimination and stigma because I look as per the society normal.
When we talk about stigma, obviously it is still very much there. Double stigma, because if a person is from LGBTQI and HIV positive, obviously it kind of entails two levels of stigma. So there is very much still there. Thankfully, people presently are more aware about issues. They are more empathetic. At least at some quarters, they are quite empathetic about the issues because they know how HIV is spread and some background about the disease. Earlier that was not the case. At our place what we do is we have something called accompanied referrals. So we have sensitized doctors and the paramedical staff at the government sector in a way that whoever basically comes would not be questioned in a very odd way or in a very discriminative way.
When it comes to queer community and especially transgender folks, and within the transgender folks, people who belong to socio-ethnic groups like Hijra and Kinnar community, there are multiple layers of stigma which are attached to these groups. The medical history has a very unfortunate past of stigmatizing transgender people as having mental illness. They have long been considered as having a gender identity disorder and that was categorized as a disease. They were considered people who are psychologically ill, who cannot think about themselves. The first time that the healthcare system came face to face with the trans and Hijra community was when the National AIDS Control Program was rolled out, and it specifically talked about trans people as a higher risk group. Before that, it was never separately recognized. Its needs and special characteristics were never discussed in a national health program.